remarks. First, I'd like to introduce Dr. Timothy Regan. Dr. Regan serves as both the Chief Medical Officer for Lakeland Regional Health and also the President of the Lakeland Regional Health Medical Center. In addition, Dr. Regan is an emergency medicine physician, and he has been picking up many extra shifts in the recent weeks to be able to care for the extremely high volumes of patients that we've been seeing coming through the doors of our emergency department. We also have with us today Dr. Stephen Ockinger. He is the managing partner at the Watson Clinic. And Dr. Ockinger has been a vocal advocate for COVID precautions since the beginning of the pandemic. And he has also led the Watson Clinic through their response, providing testing and necessary treatment and vaccinations out in the ambulatory environment. And then lastly, we have Dr. Joy Jackson, who serves as the director of the Department of Health for both Polk and Hardy counties. And Dr. Jackson has been instrumental in leading collaborative efforts across the county for the past 18 months through the COVID-19 pandemic, coordinating data and large-scale testing and vaccination operations to help protect the community. So I'd really like to thank and acknowledge these three clinical leaders. It is through their work that we have been able to navigate the past 18 months. And unfortunately, we find ourselves back of having this at the forefront of our conversations again today, but really would like to just acknowledge the tremendous efforts on the part of these three individuals and greatly appreciate them taking the time out of their busy schedules with all that's going on right now to be able to be here today and share their perspectives of the current situation. We really felt it was important to hold this press conference today to share with you how serious we feel that the COVID-19 situation is here locally, particularly with the spread of the Delta variant. After we go through our presentations, we will allow some time at the end for some question and answer session. So I'll start by saying that, like many of you, I thought that once we began rolling out with vaccines earlier this year, that the worst of the COVID-19 pandemic was behind us. In fact, on June 25th, so just a few short weeks ago, we had only 41 hospitalized COVID-19 patients at our facility. So we were feeling that things were in a pretty good position at that point. But unfortunately, over the last several weeks, things have taken a pretty drastic turn for the worse. We have seen our cases count to increase much higher than they've ever been over the course of. In fact, today we have 275 patients that are hospitalized at Lakeland Regional. For perspective, we had 180 during our last peak. So this is providing us with a lot of additional strain on our local healthcare system that we need to continue to work to manage to ensure that we can still be able to provide the necessary healthcare services for the community that we're so honored to serve. I'd like to share with you a few of our graphs and statistics to show you the dramatic increase in the numbers that we've been experiencing here at Lakeland Regional Health. So first, from an emergency room admissions perspective, you can see the line that has been tracking this number since the beginning of the pandemic and the market increase that we have seen over the last several weeks that really then allows us to have the high inpatient census that we've noted. In addition to the patients that we admit, we're also seeing much higher volumes of patients that are coming for treatment and then being released home from the emergency department as well. So you can see just another drastic increase in the volumes of patients coming to us for COVID care at the hospital. And then I mentioned our current census being at 275. That's over 30% of the total patients that are hospitalized at Lakeland Regional Health today have a COVID-19 positive diagnosis. So there's three things that I would like to really share with you from my perspective as healthcare CEO regarding what we're seeing right now with COVID-19 and with the Delta variant in particular. First, we have witnessed an extremely rapid spread for COVID-19 Delta variant, showing that it's much more contagious than the past variants that we've had. Reports have shown that it's 60% more contagious than prior strains. And that results in a transmission of, if one person is positive, there could be up to 5 to 9 other individuals that could be infected. So what I've been saying is if you don't know someone with COVID-19 right now, the data is indicating that you will know someone very soon. So this is really touching all of us across the community right now. The second point that I would like to share is that the individuals that we're seeing test positive and come to us for hospitalization right now are much younger, and they're largely an unvaccinated population compared to where we had been earlier in the pandemic. Unfortunately, we have individuals in their 30s, 40s, and 50s that are with us in the hospital. Many of the patients in our ICU fall into these lower age demographics, and even some of the patients that are on ventilators today are these younger individuals that are with us for COVID care. So what can we do about it? My most important point that I want to drive home today is please consider getting vaccinated. We've shown that the vaccine is safe, it's effective in preventing against severe disease. If you've not received it yet, I would highly encourage you to consider doing so. My family and I are vaccinated, and I really would encourage you to consider the same for yourself to protect not only yourself, but also for those that you care about as we continue to navigate the uncertainty in the weeks ahead. So with that, I would now like to turn it over to Dr. Regan to share with you some more perspective on what he is seeing in our health system and across the community.
Thank you, Danielle. As Danielle mentioned, I do consider myself still an emergency physician. I don't practice as much as I used to now that I'm chief medical officer, but I have started to work more shifts in the emergency department just to help our team out because the numbers that we are seeing arrive are unlike anything that I've ever seen in my career. My perspective as a physician and as someone who's a leader in the medical staff, this is an incredibly sad and frustrating situation that could very easily be prevented by the acceptance of the fact that this is a true disease and that the vaccines work. It's disheartening, it's frustrating that there's distrust in the scientific community that these vaccines are effective. People are focusing more on one-off stories on social media or things their neighbors are telling them and paying less attention to the actual scientific data and the fact that there have been billions and billions and billions of doses of vaccine administered to people, and it's happened very safely. To echo Danielle, I'm vaccinated, my wife is vaccinated, my girls are vaccinated. My little guy is not vaccinated yet because he is 11, and that scares me as we're coming into the school year. I do want to address a few people in the community, to the community at large, to Polk County and people in Lakeland. I've treated thousands and thousands of you as an emergency physician over my career here at Lakeland Regional. And now as part of the leadership team, I just need you all to know that we stand committed to helping our community, our neighbors, our friends navigate this crisis, and we're doing so to the best of our ability. So at Lakeland Regional Health, we are doing multiple things to help keep the community safe. We are expanding our emergency department hours and availability. I mean, we're open 24 hours a day, obviously, but we are expanding the places where patients who come to the emergency room can be seen. For those of you who know about Regeneron, which is a monoclonal antibody therapy that's very effective, we have been the leader in Florida in administering this medication, and we have been incredibly effective at keeping people from being hospitalized. We have increased our capabilities as demand increases to the point now we are seeing 50 patients a day that we are administering this therapy to, and we have saved thousands of hospitalizations. We are opening respiratory care clinics to help offset the patients who are coming to the emergency department, looking for care, looking for testing, looking for advice on COVID. And we continue to look for ways where we can hospitalize patients and have people in the appropriate care areas despite unprecedented numbers in the medical center. To my community members who are vaccinated, thank you and congratulations. As an emergency physician and as somebody who knows the statistics of the hospital, you represent the vast minority of people who need care. People have seemed to have lost sight of the fact that vaccines although are intended to prevent disease, they don't always do so. The concept of, quote, breakthrough cases is a frustrating new terminology because with any vaccine, there are always breakthrough cases. It's to be expected. The idea is that you don't get hospitalized or you don't die from the disease. That's what vaccines are for. So thank you if you've been vaccinated. To those who are unvaccinated and are unconvinced to get vaccinated, we wish you good luck in this journey. You will most likely get infected in the next 2 months. That's just the reality of the data that we're seeing. The other reality is that we don't know who does poorly. We don't know who will be admitted to an ICU setting. We don't know who will need to be intubated. We're seeing young, healthy people that are having very bad outcomes. So we are prepared to treat you with the most cutting-edge treatments. If you do get infected, and we encourage you to seek treatment, despite not being vaccinated, we still care for you. To those who are unvaccinated and are on the fence, this is real. If there are any questions we can answer to make you feel more comfortable, we want to provide you that information. We are not fear-mongers. We're not trying to scare you. But here's reality, and this is what is sad. We are bringing 8 and 10-year-olds to the bedside of their parents to say their last goodbyes. People who we've extended treatment and we just can't save them. We're having teenagers in the ICU say goodbye to their parents. This is what is sad, and this is easily preventable. So to Polk County, I encourage you to get vaccinated if you have not been infected yet. It's extremely effective. You'll have minimal side effects if you do have side effects, and you'll be safe. So I encourage all of you to seek the vaccine and to do what you can to keep yourself safe. Thank you. And I'd like to introduce Dr. Ackinger to say a few words.
Thank you very much, Tim. Thank you, Danielle, for those kind words, and thank you for the members of the press for coming today to hear what we have to say. I would echo just one of the sentiments that Dr. Regan expressed is, yeah, I would say I'm a little frustrated. I think over the last year and a half, it's fair to say that we felt a little bit not listened to, and I'm just not used to that in my career. I'm used to sitting down one-to-one with a person and doing my best to give them the best advice to keep them healthy. And I'm doing the same today. It's no different. It's just, I'm not speaking to one person, but hopefully speaking to the entire community. So please, please listen. Because now's the time. I don't want to reiterate the issues of the Delta variant and what it's doing. However, I would like to share a little bit of some of the data that we have been collecting at Watson Clinic, just to share this with the community so that you know. We have seen a rapid increase in the number of people seeking care in our urgent care departments and express care and seeking COVID testing. In the entire month of June, we performed about 3,186 COVID tests. 5.5% of those were positive tests. In July, we performed roughly double that at 5,618 tests with a 24.3% positivity rate. So far in the first days of August, we have already performed 1,763 COVID tests, and 29.5% of those are positive. These are staggering increases and suggest a almost geometric growth in the rate of transmission of the disease in the community. That means that your risk of contracting COVID has never been higher since the beginning of the pandemic, and I think you should know that. Breaking these numbers down a little further, there doesn't seem to be a particular age group that is spared. 10% of these are occurring in children under the age of 12. Roughly 30% of the tests, or 1 in 3 of our tests, positive tests are occurring in those under the age of 30. And only 12% are occurring in those above the age of 65. So there's definitely not any particular segment of our population that is being spared. And the frustrating part is, like my colleagues have alluded to earlier, is that this can be prevented. This can be prevented. When you are given a treatment which has a 95% effectivity rate, that's actually a very good treatment and among the best that we have for any condition, any illness that we have. So these vaccines work, and they can put an end to this pandemic. I'm recalling kind of earlier in time when it seemed like everybody wanted to get a vaccine, and that was a great problem to have. Unfortunately, it's hard to give them away now, and we do. They are free. So it's mind-numbing that we have been seeing the low rates of vaccination among the community over the last couple of months. So what do we do now? We need to go back to the basics to get right through the current crisis that we're in. The ways of mitigating the spread of the illness. I would echo what the CDC recommends for us all to lower your risk of acquiring COVID. Individuals should continue to wear a mask in public, indoors, regardless of your vaccination status. You should wear a mask outdoors if social distancing is not possible. You should maintain social distancing measures of at least 6 feet. You should wash your hands frequently and thoroughly with soap and water. If these are not available, use a hand sanitizer with an alcohol content of 60 to 95%. If you aren't feeling well and you don't think that you are acutely sick, stay home and get tested. If you have severe symptoms such as shortness of breath, severe fevers, dehydration, of course, please seek medical care. But those with mild illness, the best place to be is staying at home, quarantining, and getting tested. So, vaccinations, the only positive that we're seeing in the last couple of weeks is a slight uptick in our demand vaccines. So we need to continue that. If you are vaccinated, encourage a neighbor to get vaccinated. It's amazing the influence that we have over each other. People look to each other. They look to their friends, to their colleagues, to their family to help them make their healthcare decisions. So help me in that. Participate in that. Talk to someone who hasn't been vaccinated. Share them your positive experience with the vaccine, because that's the best way that we are going to get through this. Yes, breakthrough infections happen, as Dr. Regan alluded to, but these are happening because of the high rates of transmission in the community. So don't be alarmed, get vaccinated. Don't overthink it, get vaccinated. These same guidelines apply to children as well for staying safe. Obviously, we do not have vaccines for those under 12, so it's even more important that they practice these mitigation strategies that I just reviewed a minute ago. Masking in public, masking indoors, maintaining social distance of at least 6 feet, because these are the only ways to stop the spread of this illness in the youngsters. So, thank you for inviting me to today's event. Everyone who's received the vaccine, again, my heartfelt thank you. Thank you for believing in us, believing in science, and believing in each other, because that's how we're going to get through this. I like to say that public health is a team sport, and we need everybody on board. So let's get through this together, and as always, we'll be here for you. Thank you.
Good afternoon. I'm Dr. Joy Jackson. I'm the health officer for DOH Polk. And first and foremost, I'm a resident of Polk County. I've been here for over 30 years. I'm a primary care physician. So my heart breaks when I hear my colleagues talk about what they see face to face with individual patients and situations. When I'm in my public health hat, I'm thinking about populations. When I listen to them and they're seeing and they're encountering individuals and families, that's where the pain of this is occurring. So my purpose today is to again give you some data and show you that this is absolutely real, to talk about our vaccination status and what we are starting to see over the past couple of weeks, and to voice some encouragement as we go forward together. As Dr. Ackinger said, this pandemic requires an entire public health response, which is more than the health department. It's all the providers, the people, our first responders, our business owners, our government entities. It's going to take all of us to get through this pandemic. So this is the ugly slide showing our weekly case numbers. So the bars obviously show the number of cases per week. The week of June 18th to June 24th, we had 400 cases identified in Polk County. And this was pretty stable, pretty consistent for about the 5 or 6 weeks before that. We'd sort of flattened the curve to that number per week. The following week, we started ticking up at about 500 that week. And my hair started sizzling. It wasn't on fire yet, but I'm starting to get concerned because we were seeing what was going on in India and other parts of the world with Delta variant. And we weren't sure if we had that here yet. The following week, the week of July 2nd to July the 8th, we had 700 cases. So between the June 24th and July the 8th, we almost doubled in cases. The following week, July the 9th to July the 15th, we had 1,400 cases. July 16th to July 22, we had 2,500 cases. The week that ended July 29th, we had 4,100 cases. So if you want to do the math, you'll see that we're doubling our case count every 8 to 9 days. I will give you a preview of data that will be released tomorrow. Polk County had its highest daily case count yesterday. And I'm saying yesterday because I haven't seen today's numbers yet because obviously they're not fully reported. We had nearly 1,000 cases in Polk County in one day, yesterday. Of these, 14% of the cases were in children 14 and younger. So for individuals who say, oh, kids don't get this, that is absolutely untrue. Kids can get infected. Kids can transmit infection. The good news is that children, particularly younger children, are generally less ill. Thank the Lord for that. But kids can absolutely get infected. So you may ask, is there testing availability in Polk County? In the past 7 days, 22,000 tests were reported in Polk County. 22,000 tests were reported in Polk County, of which our average case positivity was 25%. To remind you, our goal for case positivity is to be low, certainly under 10%. And we were there the end of May, beginning of June. With our case rate of about 300-400 a week, our positivity was about 4%. We thought this thing was in our rearview mirror. Boy, were we wrong. We were wrong. And that's been the hardest part about this surge, is getting people to believe that it's true. I promise you, with all sincerity, it is absolutely true. So that's absolutely the bad news. Let's talk about what we're doing as a community to make things look better, and that is vaccination. So where are we right now? To remind you, Polk County's overall population is around 719,000. Of our overall population, about 335,000 have received at least one dose of vaccine, which is 46% of total population. Only 39% are fully vaccinated. I really think that the important metric is of the people who are eligible for vaccine, which is 12 and older, what percentage are vaccinated? We're at 54%. So we're inching up, but 54% ain't good enough. It's not good enough if we really want to slow this thing down. Our most vaccinated group is our 65 and olders, and they are about 83% vaccinated. What we are seeing is that we're having fewer elderly people admitted to the hospital, fewer elderly people succumbing, dying, having severe illness, and that demonstrates the effectiveness of vaccination. We are showing it in this county that our older people, although they're not without disease, this time a year ago, oh man, we had outbreaks in 40 long-term care facilities. The hospital was full of people that were over 70, 75, and we had a lot of deaths. We don't have that nearly as much this year because of vaccination. So if somebody wants proof that vaccination works, we're showing it. So what's gone on in the past few weeks? We're doing better. People are getting vaccinated. As Dr. Ackinger said, I will remind you that COVID vaccines became readily available in the April to May timeframe. When they first rolled out the end of December and January, man, we had people lined up. My phone system was crashing. The county had to stand up a phone system. We called upon Watson Clinic, Lakeland Regional, Winter Haven Hospital, all of our vaccine partners to help us put shots in arms as we were waiting for the point there was enough vaccine to go around. Guess what? We have enough vaccine now. We have enough places to go. And when we hit that point, all of a sudden people didn't want it anymore. And we were vaccinating countywide maybe a couple thousand people a week. But at least people are now starting to pay attention. A couple of weeks ago, we vaccinated 3,620. 2 weeks ago, 5,222, and this is down to the number. I'm telling you, I live by these numbers. The week ending July 29th, 8,200, and tomorrow you will see a report, and I'm giving you the preview. It's going to be well over 9,000 vaccines in the past week. So I want to especially thank those who evidently were on the fence because they didn't get it earlier, but they're getting it now. And we need that to continue. So thank you to those that have gotten it. Thank you to those who are getting it. If you're on the fence and you have a question, you call me, you call my office, and I will give you the facts about vaccines, which is that they are safe, they are highly effective, and they can help prevent serious illness, hospitalization, and death. That is what we're all here for, is we want to help keep our population from being ill, being in the hospital, and dying. Our hospitals are at capacity. And I hear it in their voices, I see it in their numbers, and I hear it from people that are experiencing it. So I beg the public to please get your vaccinations. I'm going to turn it back over to Ms. Drummond.
Thank you, Dr. Jackson, and all of our presenters, and again to all of you for being here today. In closing, obviously all of these statistics and stories that we hear really, speak to how much COVID-19 has been impacting us as individuals, as families, and as a community at large. It certainly is very encouraging to see the increases in the number of vaccinations being provided in recent weeks. So again, thanks to all of you who have been vaccinated, who have received your vaccine, and again, just words of encouragement for all of you that are considering it. Hopefully the comments today were helpful for you in that decision-making process. One other closing comment I'd like to share is just a tremendous amount of appreciation and gratitude for the amazing healthcare providers that we have in this community. I can't tell you all how blessed we are to have this team at the bedside in our organization and across all of the other healthcare institutions here in Polk County. They are truly heroes, and on behalf of our board of directors, as well as our leadership team, I would just like to thank them for all that they have done over the past 18 months. They are selfless, they are courageous, they have sacrificed so much, and I would just like to extend our heartfelt appreciation for all that they have done and will be continuing to do. And then lastly, I'd also like to thank all of you for helping us continue to get the word out about the current situation and what we know that we can do to all come together as a community to be able to hopefully get COVID-19 behind us in the near future. So with that, I'd like to open it up. We have time for a few questions and answers before I'll let my colleagues get back to their patient care duties, but certainly would welcome any questions that may be here today. Yes? No, I'm sorry. Thank you for that clarification. 275 is the number of COVID positive patients. That represents 30% of our total inpatient census today. Yep.
For everyone up here, is it time for more businesses in the community, like Publix, Target, Walmart, to bring back the mask mandates for everyone? Because right now, it's giving them level transmission. Is it time for more private companies to step up to the plate and say, or at least for the next few weeks to get through this surge, everybody should mask up when they go shopping in these big public stores?
Yeah, I think it's definitely a conversation that needs to be occurring. I think that clearly based on the CDC guidelines, there are some environments where I would strongly encourage if someone is looking to consider that in their environment, that it absolutely would help to protect individuals if they would wear masks again, regardless of vaccination status, given what we're seeing right now and what we've learned in the last several weeks and months regarding the impact of the Delta variant.
As for Dr. Jackson, thank you for the update today. As you know, we're not getting these daily numbers from the states. Can you commit, at least here in Polk County, to give us more daily updates on the cases, the vaccinations, because that is very helpful to get a snapshot of what's going on. Can you commit to do that?
Thank you for giving me an excuse to come back up and get my mask. I will unfortunately have difficulty in providing daily updates. The state of Florida provides weekly updates on Fridays for sort of high-level data. I would like to steer you to the CDC website. There's a data tracker, CDC COVID data tracker, that is actually a phenomenal resource because it pulls data from multiple places and it's surveillance for cases, ages, vaccination rates, deaths. It is far better than what I can provide on a day-to-day basis. When I have an opportunity, and you can get down to Polk County data. So it's not for the faint of heart. You got to tool around on it, but I would really encourage you to look at that website. If I give out a bunch of data, I'm going to get something wrong, and something hasn't been updated. And then you guys are going to be breathing down my neck because I gave you bad data. So please go to the CDC website.
Do you have you said it was, I think it was New York Valley, the exact number for yesterday's record high case?
Yep, yesterday we had, as far as cases, 989 cases yesterday.
That's the most in one day.
That's absolutely the most we've ever had in one day.
And lastly, this has been probably the biggest, maybe politicized point of this whole pandemic is the mask regarding children in schools. You know, the governor has signed this executive order. What do you want to say to the parents who are concerned when their children go back there? You said 14% under, I believe, 14 years old.
Yeah.
Is it maybe plausible to have a short-term mask mandate to keep these children and their families safe for the next few weeks?
What I can say is I want parents to understand two things. Number one, their children can get COVID. I hope their kids don't get COVID. And if they do, I hope it's not very serious. Kids can get COVID, and parents have the ability to make the decision for their child. So we encourage them, if they're concerned, to encourage their child to wear a mask at school.
Dr. Jackson, we already know that at least one school has had to close down already. What do you think is going to happen without any of these COVID-19 precautions in place?
Well, we're going to see. School starts in a week, and we will see what happens. We have been communicating every day, sometimes multiple times a day, with the school district, and we have a team that works at the school district site and my epi department and communications department. So we're going to work the best we can to be on top of things, but we'll have to see what happens. Because as you know, under 12s cannot be vaccinated yet. So we encourage parents to have conversations with their children, and if it's right for them and their children, to encourage children to wear a mask.
Do you think the best plan is in place right now for schools?
You know, I can't address that. A plan is in place, and I respect that decision makers have made that plan, and the health department will be with these entities as we go on this journey together.
I'd like to ask if, during this surge the last few weeks, how many deaths you've had from COVID in the age range, and if they were vaccinated or not?
And I honestly cannot tell you in the past few weeks. What I'm hearing from my EPIs that we've not had a significant increase in deaths yet. I will tell you that deaths usually lag surges by weeks because people are usually sick for a while before they succumb. The death certificates have to be, supplied, and the data has to be updated. So I think the time to look for any increase in deaths is going to be in the next 2 to 4 weeks. But we have not seen a significant increase in Polk recently.
For the doctors, heard anecdotal stories of people who are sick in the ICU having this regret about not being vaccinated. Is that something, gentlemen, you guys are hearing from patients who come in pretty ill?
Absolutely. I mean, that's what's so frustrating. Oh, I'm sorry. The question you're asking is the regret about not being vaccinated, people who are essentially on their deathbed, not vaccinated. And that's an absolute entity now. You know, there are the stages of grief, and one of them is bargaining, and this is part of it. Can I just get vaccinated now? And unfortunately, at this point, if you're infected, it's too late to get vaccinated. You have to rely on your body's immune system to build up antibodies to fight. And that's the purpose of the vaccine, is to initiate your immune system to build antibodies so that you don't get infected with the true virus. So it's regrettable. It's horrible. It's horrible that people could have gotten a simple shot. They could have stopped in Publix while they were shopping, got a shot, and gone on with their day. And now they're in the ICU dying. We're talking about 30-year-olds and 40-year-olds who are in the ICU or on high-flow oxygen. I mean, the stories that I'm telling you are real. We had, just a few days ago, we had an 8 and a 10-year-old had to come to the ICU to say bye to mom, who's 38 years old. That's awful. That is awful. And so it is disheartening, but it's understandable why there's concern. There is a lot of misinformation out there. But again, people tend to focus on the one-offs rather than the real numbers. It's billions and billions and billions and billions of vaccine doses that have been given. And why there's a reluctance to pay attention to that versus the one-off stories is frustrating. So, for people who have questions, we're available here to answer questions. We want to answer the questions. We get that it's confusing. We get that people are out there and they're scared, and it's more convenient to not get vaccinated than to go get vaccinated. But they are saving people. The vaccines are saving people.
Dr. Regan, up in Duval County, doctors were before the school board since Tuesday urging them for a mask policy. I respect what Dr. Jackson said. But do the Lakeland Regional Health, doctors, Polk County Medical Association, do they have any plans to ask for a mask mandate in the first few weeks of school?
I'm not aware of any plans to ask for that. I'm not aware of any plans.
Do you think there are measures that either local officials, government entities should be taking at this time or encouraging at this time more strongly than they are to prevent further spread and transmission?
Well, my medical opinion is the same that it's been throughout. It's the social distancing, and masks prevent infection, and vaccines prevent infection. So, we're not policymakers, we're just doctors. And so, the policymakers are making decisions for the community. And and my job as a citizen is to abide by it, but, but people should pay attention to the safety measures outlined by the CDC that Dr. Ackinger provided. Time for one more?
We've heard a lot about this pandemic about the asymptomatic transition. The Delta variant, are we still seeing a lot of people asymptomatic during this potentially non-spread, or are we seeing more symptoms of those spread?
Well, it's hard to say because a lot of times the asymptomatic people aren't being tested, and maybe Dr. Jackson could give you more information. I can give you my perspective as an emergency physician seeing patients. We have a policy where anyone who gets admitted to the hospital has to be tested. And so of the 200 and some odd patients that are positive, not all of them are admitted because they have COVID symptoms. Some of them are vaccinated people who tested positive that are asymptomatic for COVID but have other illnesses that may land you in the hospital. And so, so there is a phenomenon of asymptomatic carriers. It's hard to know who's out there because they're typically not going to get tested unless they're traveling or are asked to get a test.
Well, thank you all again for being with us today. We greatly appreciate your support and helping us get the message out, and really appreciate all the great questions and attention that you spent with us today. So thanks again for being here.